On behalf of my secretary, of our secretary, and the Department of Health and Human Services, I'm excited to announce that the City of Chicago has been awarded a grant of $11.5 million for the Chicago Tobacco Prevention Project. Congratulations. Chicago's award reflects the city's track record of leadership in tobacco control, policies, and prevention programs. And it reflects the growing need to address tobacco use and exposure to secondhand smoke as leading causes of chronic disease and death in the United States.
As one of only 44 communities identified nationwide, Chicago has clearly established itself as a leading in public health, wellness, and prevention. This grant will greatly benefit vulnerable populations, including minorities and economically disadvantaged, but it will also yield success, greater awareness, and better health of the Chicago area as a whole. And most importantly, it is a shining example of the difference that we're able to make, not just locally, but on a national level.
These new federal funds are certainly something to celebrate, because they will be put to work fighting a major public health threat. The statistics about smoking in the United States are clear, and they are grim. Cigarette smoking is responsible for about 1 in 5 deaths annually, or about 443,000 deaths per year. About 49,000 people die every year from causes related to secondhand smoke. More than 80% of adult smokers began smoking when they were 18 or younger. And in addition to young people, there are other demographic groups of heightened concern. Smoking rates are high among active duty military personnel, as well as among military veterans. Smoking rates are high in the LGBT community, as well as in some immigrant communities. Rates are also high among food service workers and among people diagnosed with mental illness. Federal grants funds will enable us to reach and serve groups with higher rates of smoking, people who often are not reached with traditional outreach efforts.
70% of the smokers who are asked say they're trying to quit. They want to quit. The Chicago Tobacco Prevention Project will target those individuals who want to quit and help them to provide local resources in order to do so. Specifically, there are 4 components to our 2-year project. 1, policy initiatives to reduce exposure to secondhand smoke, increase the use of smoking cessation services, increase insurer-employer coverage of these types of services, and reduce tobacco advertising to youth and youth access to tobacco. Policy initiatives are at the core of this program. Smoking cessation programming is an important component to this program. We will bring smoking cessation to the community, to businesses, and to healthcare systems. We will do more over the next 2 years to engage our youth and to adopt policies that target the reduction and prevention of youth smoking. And finally, TV, radio, and print media campaigns to prevent youth from starting to smoke and encourage those smokers who want to quit to be successful. Each of these proposed components has been shown to decrease smoking and exposures to secondhand smoke. Tobacco control programs in other states and cities across the U.S. have shown maximum impact when you can do these simultaneously. Tobacco carries a heavy economic burden. Each year, tobacco costs our nation $193 billion in direct health care costs and lost productivity. Despite steady progress with policies such as Smoke-Free Chicago, Smoke-Free Illinois, and the like, there is still substantial work that we can do to prevent youth smoking and help people who want to quit do so. We all know that the voice of big tobacco in our society is pervasive. The Chicago Tobacco Prevention Project will give us an opportunity to respond to big tobacco with a unified voice and concentrated resources like we have never had before in tobacco control. Comprehensive tobacco control programs save lives, improve wellness, and save money.